Dr. Andrew Eller. Welcome, and thank you for coming on to be interviewed today.
Thank you, Lonnie. It's nice to be here.
Well, it really is always great to see you. I know from the years that we've worked together, your clinic is incredibly busy, and you have a lot of patients who you've helped over the years, and you see so many of our patients who deal with the conditions that really affect the retina that are terribly aggressive in terms of vision loss. So I know that taking you away from the clinic is challenging, but also that you're that this is something that I think our viewers who get a chance to hear this will appreciate learning a little bit about you. So I'll start off. One thing I see, you went to Penn State, which we won't get into, too much because this is the University of Pittsburgh. But you've, along the path of your education and along the track that you start off in your career and deciding what you wanted to do, you decided to get into medicine and then decided to get into ophthalmology. Tell us some of the things that were important in that decision process and what really inspired you to get into the field that you're in.
I will first backtrack and talk about Pitt versus Penn State. I came here to look at Pitt in, I think, about late 60s. And at that time, it was a very smoky city. And I came in the summer, and it was a hot, sticky summer day in Pittsburgh with the smoke billowing out of the mills down on the south side and along the river, which is all high tech. And then I went up and looked at Penn State. It was this green, pastoral, beautiful campus, and the deal was sealed for me. Now, I have to tell you, I am a big Pitt fan after 35 years in Pittsburgh, but it took a while to kind of come around. So I'm happy to say that I've lived on both campuses.
You can wear your blue and white proudly. It's okay.
Right. And now that Pittsburgh is a much cleaner city, I do like living here.
Good.
When I came out here from the East Coast, I really thought 5 years, I'm going to get some experience and get a taste of an academic university program that we have here, and then go back east and where I have family and a lot of friends. But since that time, Pittsburgh has definitely become home. And I used to say, I don't want to be buried in Pittsburgh, and now I think I should start looking for a cemetery plot long before I do that.
Please, yes.
Well, as far as a career goes, I was looking for a profession. Definitely looking for a profession. And, talking to my parents, they said, well, you can be a lawyer, you can be a dentist, you can be a podiatrist, you can be a physician, but a profession will at least allow you to have a job and feed your family and have something interesting to do in life. And it's important to have something that you like doing, that you get up every morning saying, I look forward to going to work. And so I kind of got steered more towards medicine because I couldn't see sitting at a desk all day as an attorney. So I was very fortunate. I have two uncles who at the time were optometrists, practicing optometrists, and they just said, eye work is just so exciting, providing vision for people, restoring vision, even if it's just giving them a pair of glasses that allows them to see better. It's very satisfying. And they said, when you get to medical school, look at everything. Look at surgery, look at medicine, look at pediatrics, but pay special attention to ophthalmology because it's a great career.
Well, they gave you good advice.
They really guided me in that, and I did spend a lot of time looking at ophthalmology, and there were some other specialties in medicine I really, really enjoyed as well, but nothing came close to ophthalmology. So I feel like I made some very good decisions, and some very good mentors along the way.
Well, I agree because you really, and I say this not speaking, from personal experience, but but certainly hearing many, many times from many, many patients, the kind of care and attention that you pay to them and how much they appreciate that. So I think that you made the right choice, obviously. And I know you've helped a lot of people with their vision, most definitely. So your work in the department, you focus primarily, clinically, but you've been involved and very supportive of all the activities, the research and everything that goes on. I know that are really hopeful that some of these things are going to be available for your patients in the future that we're working on. But you're pretty focused on, on some of your own academic work too, that relates to, trying to improve and advance care and trying to make care better for patients. Share with us a few of the things which that are going on that you think people would find exciting.
So most of my work, as you say, is clinical, but also clinical research. And clinical research can take two forms. One is just looking back at patients I've treated over the years and assembling a list of them and looking at trends. So for example, I published a paper looking at 50 retinal detachment procedures done in younger people and basically highlighting a surgical technique that's an older technique that a lot of people have gotten away from, and that's the placement of a scleral buckle, but showing how in a younger person with a detachment, it can be a preferred method of treatment. In fact, when I submitted the manuscript for publication, it was rejected. And I wrote back to the editor-in-chief and I said, I can understand how 30 years ago you would look at this paper and say, so what?
Mm-hmm.
It doesn't tell us anything we don't already know. But as the technology has kind of advanced surgically, people have forgotten about some of these older standard treatments. And he said, okay, I'll take it. And now it's listed in one of the top 50, I just timed out here, one of the top 50 papers that's recommended for trainees in vitreous surgery. So that's one of the types of papers that I've written is looking at clinical histories of patients and then writing that up and saying, this is something that we would do. The other type of clinical research we do is sponsored clinical trials. So for example, I'm currently involved with a drug trial with a somewhat of a newish company that has an idea for treating the dry type of macular degeneration. So we're recruiting patients for this trial, and we've just started our first patient in it. And it's an injection actually in the skin, in the abdomen, like an insulin injection. But this is a drug that works against a protein that accumulates in the retina in patients with macular degeneration. So we're trying to block the production of this protein to see if by reducing the amount of it that's being laid down or deposited in the retina may actually reduce the rate of progression of the dry type of macular degeneration. So
that's
very exciting. And over the years, we've done a number of clinical trials for diabetes and macular degeneration. We also participate in clinical trials with other departments. Some of the new cancer treatment drugs have side effects that affect the eye. And so the drug companies and the FDA require that all of these patients get routine eye exams. And then I've also doing one research trial with mice. And it's really exciting. It's in a collaboration with the radiation oncology department. When people get radiation treatment affecting the eye, it can damage the retina. And so the chairman of the radiation department at Pitt, radiation oncology, Dr. Greenberger, has an experimental drug, and we've been injecting that into mouse eyes, and
mice, yeah.
Mice eyes, I guess is correct. And then we treat the mice with radiation, and then we examine the eyes to see if this drug is protecting them. Pretty interesting, actually.
That's really interesting. With the with the retina, the challenging thing, and it must be, you must have seen a lot of progress over time, but it seems like things like dry macular degeneration, which we still don't have, a lot of answers for, that the progress has been sort of moving along slowly to try to get to where we have, some treatments. Do you see that changing in the near future? Do you think that we'll see more and more things like you're working on with the clinical trial now with, with this protein blocker and other things? Do you think we'll see more things coming out for patients with dry macular degeneration that would be available?
I would bet there may be a dozen different drugs in trial or trials that have been tried and failed for the dry type of macular degeneration. So what we're very fortunate about is that the drug companies are willing to take the risk of the investment in trying to search for treatments, because you have to think about it as the wet type of macular degeneration is basically a production of scar tissue, if you will, against the drying. So if you look at it in two levels, the drying is our aging process. And everybody, Lonnie, ages differently. Mm-hmm. You go to your high school reunion, some people look 80 and some people look 20. And some people have had knee replacements and some people are fine. So some people need a heart valve. Different body parts wear out at different times. And in macular degeneration, it's no different. Some people age beautifully with their retinas and other people, their retinas age badly. And that we would call the dry type. It's just a natural aging process in some people and probably genetically based with some other risk factors. And the wet type is basically the body's reaction against the drying or the aging changes. So the body says, I don't like aging, I'm going to fix it, I'll grow scar tissue. So in other words, think of it as aging as the retina thinning. The body says, I don't like this thinning wearing out, I'll reinforce it with scar tissue. So it grows scar tissue. Well, this in a sense is very similar to getting a cut on your hand. You get a cut in the hand, the body says, I don't like a cut in the hand, I'll heal it with scar tissue. So it's a repair, it's the body's attempt to repair. So we know that in order for the body to repair something, it sends out chemical signals that we call growth factors that stimulate the growth of scar tissue. Mm-hmm. So when this growth factor was found in the retina, the drug companies were then able to build a drug that blocks the growth factor, and that's how we treat the wet type.
Right.
We're treating a reaction. Mm-hmm. The dry type, that's aging. How do we stop aging? Whether it's Alzheimer's or bad knees or bad heart or bad lungs or whatever, we are aging, or just plain wrinkles. And so now we're getting back into the biology of aging.
Okay.
And that's why that's such a big hurdle. And the fact that drug companies are spending billions of dollars to look for an answer is very encouraging. And so they will keep at it and they'll keep at it until we find something.
Well, I guess everybody'd like them to find some cure for aging. That would be
right. Right.
So, well, and you're right. I think, so many people have the condition, and that in a sense also means that there will be a lot of incentive on the pharmaceutical companies to help us find a solution. So now you've been at this a long time, and you have treated so many patients, and I bet you there's a lot of, I'm sure you have many stories that are very interesting about that. If you were to talk about one thing, and it'd be a patient or even just some things that in your practice or even in your training of other physicians that stands out in your mind as something that was, so incredibly positive and affirming to what you do that you're really proud of, what would stand out in your mind as one of those things that just really affirmed again your appreciation for what you do?
Almost every day I have that affirmation, which is one of the best parts about being an ophthalmologist. There's nothing like fixing the eye of a one-eyed person, because you can live with one eye, as many of my patients do, but when you have no eyes, that profoundly affects your quality of life.
Yeah.
And whenever you fix I can't think of any examples offhand where someone's come in with one eye that's been badly damaged, but there have been some over the years that I've been able to restore
Mm.
sight too, and they're driving and living a normal life.
Mm.
Actually, I can think of one gentleman a number of years ago who had a retinal detachment in one eye, and our surgery is about 85, 90% successful,
Mhm.
which would be a little discouraging, saying that 1 out of 10 people may have a failure. But typically, if you go back and do more surgery, your success rate improves, but it's not 100%.
Mhm.
And he was treated elsewhere in the state, and they couldn't fix the eye after several operations.
Mm.
And when he got a detachment in the other eye, he said, they won't be able to fix this either. And he just basically lived in a motel room, and
Oh,
by kind of feeling his way across the parking lot to the restaurant, he ate 3 meals a day and then get back to his room. And one
oh,
day he showed up in our emergency room, and I was able to get him pretty reasonable ambulatory vision after that.
oh, that's
So
great.
2 years later, about a month ago, saw a patient who was in a rodeo, and I didn't know we had rodeos in Western Pennsylvania, but he's from the Bedford area.
Yeah.
And not only did he not stay on the bull, but the bull stepped on his face, and
Oh,
he had bone fractures, and he a very major eye injury.
wow.
And we took him to the OR about a month ago, and with Dr. Vishal Janji, one of our star cornea surgeons, he did a corneal transplant while I repaired the retinal detachment. And
Wow.
I just saw him yesterday, and his eye looks fantastic, and his vision's
Wow.
starting to recover.
Wow.
So, those are some of the highlights we get to do almost on a daily basis.
Well, that's exciting. Thank
It,
you. I there's you mentioned Dr. John G, and we've had a lot of new faculty over the last few years, and we've certainly been growing, and the department's been changing. How does this impact you, and are you looking are you excited about some of the things that we may be able to do to help patients in the the near future?
well, it's great to have talented partners. We're always learning from each other, and that's one of the real advantages of working in a university setting, where we can share so much knowledge and information, and it's also it's just great to be able to continue to learn and continue to improve.
So with the department, you also are, you're one of the senior members of the team, and with the coming of some of these new things, like a new building coming up and other things, um, do you see Pittsburgh becoming a a location where we've always been extremely strong in this department and in ophthalmology? Do you see that we have potential to do even more and make a bigger impact in what we can do for patients in the future?
Absolutely. We're excited to have Dr. Sahel here. He's really quite visionary. He's almost like a philosopher when you hear him talk about the future of ophthalmology and what can be done, and the team that he's assembled around him. It's just a great place to work, and absolutely, I see more discoveries coming out.
Yeah. Well, we all hope so. And I know, speaking as someone who's had family members, my mother had macular degeneration, and she had the wet type, and her treatments didn't go so well, to where she was not really doing well with her vision before before she passed. And I really hope that we can do a lot more for people with particularly with these conditions in the retina. It's very difficult when you see people who lose the battle, and unfortunately some people do. So thank you for what you do, because again, when I talk to your patients, they light up. They really are excited, and I know that they really appreciate the care that you provide, and it comes across, and I know that you are very dedicated and spend a lot of time with people, and that's what I think that really good practitioners do, and I put you in that category for sure. So thank you so much for your time, and thank you for setting some time with us and telling us a little bit about yourself, and hope to have more opportunities.
Absolutely, anytime, Lonnie. And I'm just very, very lucky to have a job I love doing.
All right. Thank
Great.
you. You take care.
All right, thank you. Be safe.